Really good to be here with everybody, and especially to hear the first part of the program. It's so heartening to see the thrust of it all, because without us talking to each other, discussing anything together at all, you'll see that the very first thing for me is thinking about the origins of the change that we need to have. And looking, I was looking historically, just thinking about the incredible impact that families, persons who are experiencing dementia, the communities, providers, service providers, everyone having that say and being that advocate to really make sure we have change. So when I was listening to the presentations so far, it made me think about a couple of things that I think I'll share now. And so looking back, so the first time I remember being inside what we now would call a care home, then we called a nursing home, was when I was 13, I think. I was going to junior high school, so it was somewhere like in the early, maybe 60s. And I was working in the kitchen there after school from 3:30 to 7:30. We were rolling the dishes out, the dinners out on a cart, and the care staff was taking the meals to the residents. And myself and another friend who were working there, we looked, all we did was put the food on the tray and then pushed it out the door, put the whole cart out the door for someone else to get. But when we looked out the door, we saw older adults in wheelchairs, in restraints, the wheelchair tied to the little bar, the walking bar, and the resident tied to the chair. And we talked for quite a while, for probably a couple of weeks, about, like, it just didn't seem very stimulating. It didn't seem like anybody could ever have a good life being tied to a chair and then tied to a wall. And so the two of us decided that, anyway, we didn't know we were doing research, but I guess we were. We decided to each adopt, that's our language then, one of the residents who was regularly tied there when we put the meals out. We stopped and talked to them. We brought little gifts. We just engaged. And we both noticed that they seemed to be doing way better than the other people that were tied next to them. And we also had some of the care staff come to us and say, Mrs. Jones seems to be eating better. And so anyway, that was my first experience of really looking at what it would mean to be an atmosphere, an environment that was at least gave the opportunity to thrive at whatever you were able to do, to be able to do it to your maximum. And then the other thing it made me think about was I was in a care facility where I had met a fellow there. He used to be a trapper, and I noticed he wasn't very verbal, and I was just volunteering. And I used to bring in we used to have what we call coffee table books. I don't know if people call them that anymore, but books with gorgeous pictures of outdoors. And I thought, he's not verbal right now. So I think I'll just bring these books and show him and just see. And so I would talk to him. We'll say George. It wasn't George, but I would talk to him and say, "Oh, look at this! Isn't that incredible? What's going on out there? Look at this tree." And this one day, I pointed to a picture of a mountain goat on a precipice, and I said, "George, how the heck does that mountain goat stay there? Why isn't it falling off?" And out of the blue, I was told he doesn't speak. And basically it was implied that he doesn't think. And he said, center of gravity. And even I didn't understand that. I had to go look it up when I got home. So just listening to everything made me think about those two stories. And the fact that it's what we do as individuals, whatever level, wherever we are, if we're able to speak out and advocate, it really can make a difference. And for me, it made a difference in that care facility when I was 13 years old. And when I was volunteering, it also made a difference because I had some of the care staff come to me and say, well, he doesn't speak. He doesn't understand. Why are you doing that? And then he says, center of gravity, and a whole different attitude. And I don't know if it lasted when I wasn't volunteering anymore, but it opened a path for some people. And I just think that role that we all can play is so important. The actual example that I was going to talk about is the example, though, that those were things that came up after the conversation, but is the support group that developed here in Prince George. When I moved up here in 95-6 timeframe, I right away got engaged with the Alzheimer's Society here. Another example, a very active community group that grew out of the community. It was women primarily whose partners had some kind of dementia and they wanted something. And so they organized the branch up here, and really very, very engaging. And one of the questions that came up was, why do we were able to support each other, but what about the persons that were experiencing the dementia? Why didn't they have a group? And a number of people raised that, who themselves were experiencing dementia. Like, why, can we get together? And that was one of the very first, not the first, there was a couple of others already happening in British Columbia, but that was one of the first, we called it then an early stage dementia support group that was organized. I won't say solely by, there was support to help organize it, but what we did at those groups, I was a co-facilitator, and what we did there was determined by the group. And really way back then, feeling that sense of accomplishment to be able to actually make a change that was meaningful, both to the residents, in the care facilities that I talked about, but also in that case, in terms of the support group, to make a difference in the lives, both of those experiencing the dementia, as well as their partners and family members. So I guess the first thing I wanted to highlight was just that incredibly important role that we all can play. And anyway, just to highlight that. And then, of course, I want to be able to talk about some of the projects that are going on and activities that are going on in Northern BC. And it'll be a really quick description. But one of them that I'm going to spend a little bit more time on is this one, the intergenerational activities for growth and engagement. We called it the Inter-Age Project. And what happened with this project was there was three of us, myself, Shannon Freeman, professor in nursing, and then one of the managers at Northern Health, who we got together and we were talking about our own experiences within our own lives, about just the question of what happened when people got older, the connection, the engagement, the disengagement, and decided that we wanted to do something together. And anyway, much longer story short, the idea came up of having a co-housing environment where some of the university students would be able to live with adults in assisted living and long-term care. And that idea, it took a couple of years to really get it formalized and able to go. But just to give you a sense of what we did, we talked, first of all, we talked to the residents in the long-term care and assisted living location to hear what they would think about that, if they were going to have some university students live there. We talked with the staff that were working there. What did they think? Were there any issues from their perspective? We talked with students at the university about what they thought would be something that students could contribute in that environment, and what could they learn from that environment. And we talked with the administration of the university and of Northern Health. To make a much longer story a little bit shorter, we were able to successfully have all these discussions, get the input from people living there, living in the long-term care and assisted living, from the students, from Northern Health, from the university. And we were able to come up with a plan where we were able to have 2 students who would live in this particular residence. Now, one of the issues, of course, was to make sure that they weren't taking the space of a resident, potential resident, because of course we know there's wait lists. So we dealt with that. The students were staying in locations which in fact had been offices and which were not available for residents. So we were able to talk that through. We were able to talk to the students about what kind of contribution, why did they want to do it? We interviewed people to decide who would be able to be the 2 students. And we were able to have informal kinds of interview relationships with the residents, talking to the students when they came in for their interviews, and really got a feel from staff, from residents, and from the students about whether this would be a good fit and what kinds of contributions and connections people could make. It was really a very exciting process, and something that I think all of us learned from. And over time, we had 3 iterations before COVID hit, and we're hoping to be able to begin again, perhaps in the next academic year, but we're having those discussions. But the main thing to say is that this process was a collaborative process. The residents came together, they talked with the students about what they would like to learn from the students talked about things they'd like to learn, they made contributions, and importantly, we had a course that took place at the care facility and the long-term care home, where residents came, the students came, some of the staff came when they were able, some community members and family members participated. So we had both the exchange and living together situation between the residents and the students. We had a course, and from the very beginning, we integrated an evaluative process, which included a whole number of ways of speaking with the staff, the students, the residents about the experience and things that they'd like to see changed for the next period. So it's been a very exciting process. We're really enthusiastic about the response that we had. We are hoping that we'll be able to do this again and perhaps expand to some other locations. I'd love to be able to do a whole talk on this and give you some of the quotes and feedback that came from the residents, the students, and the staff and community members. It was all positive. Of course, there were things that, when residents and students were having lunch, some residents felt that they weren't maybe getting as much attention. So there was discussion about how to do that, how to rotate so that you would share the time with people. There was some struggle when students were finished their term there, because we had 3 iterations and the residents didn't want them not to be there. So we had to go through a period of time to figure out how to be able to have them come back. And they did come back as volunteers. And that was the way that we were able to sort out that part of the process. Anyway, it's a very exciting project. And I can certainly provide folks, if you'd like more information about how it happened and the work that took place, I can definitely provide that for you. The other thing that I think maybe many people on this call already know about is the Demscape project. And that project is across British Columbia, and I know the Alzheimer's Society is very aware of it. It's being, in terms of universities, it's at the main, the lead on the project is at SFU. We have also researchers at UBC and up here where I am at UNBC. And basically, really, we're trying to do so many of the things that both Jerry and Jim and also Santa talked about. And that is to actually have the folks who are experiencing dementia, their care partner if they wish, to actually do a walk through their neighborhoods and talk about what are the kinds of things that you would like to see done differently. And just trying to glean what things they're thinking, also working with those at the university who do planning, community planning in the region, talking to the city. Someone mentioned the fact that we're going into an election. Definitely talking to the city about what kinds of things they may be able to contribute as we try and sort out some of the things that we can do within all the different neighborhoods to make the experience of people who are living with dementia to be the best experience possible. And as I saw in the chat, Heather Lamb, who is also from up here and has worked very much around accessibility issues in Prince George and beyond, absolutely some of the questions that were dealt with as people were looking at the accessibility question are very relevant to dementia-friendly communities. And so I think there's a way to be able to be building on that work, absolutely, for sure. So the goal ultimately, after we do these interviews here, and they're being done in the Lower Mainland as well, is to come up with some suggested policies and initiatives that can be made in order to make the communities more dementia friendly. And for us in Northern BC, we're also trying to take into account some of the particularities of our environment here. Of course, one of those will be literally the environment and the weather, but looking at how can we contribute to that work by advocating through research to do this, to make these changes. And I think the important thing to say is that all this research work, all these initiatives are things that are being done in collaboration with people who are using these services, with families, with community members, with all the community groups that are here. It's very exciting. The other thing I wanted to talk about briefly is the Center for Technology Adoption in the North. We call it CTAN. And that's a new group that has been at UNBC now for, I guess it's getting close to a couple of years. And they've been looking at how to use technology in terms of dementia-friendly communities. And I know that I don't have time to talk about all their projects. I think Mary Lou's going to tell me when I'm getting close, but I wanted to share a couple of things. First of all, we have a demonstration lab at the university. So we've already had seniors from the community, older adults come up and look and see what some of the technology is that's being worked on. The other thing is that we had also within that work, a new housing project that's taking place in Vanderhoof, just to the west of us here, that is focused specifically on meeting the needs of those who have dementia. And one of the things that I thought was really exciting was that they are actually using a new technology that is lighting, which I'm not that familiar with, so I'm just looking it up here. It's called the Aurora Home in Vanderhoof. And one of the examples of the technology is using circadian lighting. And they partner with various companies. So the company is called NanoLit. And this lighting mimics sunlight throughout the day and brings in the qualities of natural lights indoors. And there's a range of, as you can imagine, potential health benefits that could come from that in terms of with dementia, including improving sleep or mood or reducing the sundowning. So really exciting. Another project that they're doing is a gardening project, which has been really something that so many residents, when we had the students in the residence that I talked about with the Interage project, at the same time, we started a project about having it's really a garden, an indoor, primarily indoor garden. There was some raised beds outside as well, but the main thing was that it was a resident requested and driven, co-designed hydroponic garden that was inside the assisted living location. And so from there, we've been able to, CTAN has been able to work with another company called Just Vertical, who is helping develop a vertical kind of hydroponic system that can be well placed within a care facility, within long-term care, within assisted living. And residents have just loved it, really appreciate it. They've contributed so much in terms of what we should change, what should be developed differently, just incredible contributions. And then I guess finally, as time runs out, I wanted to mention the dementia resources for eating activity and meaningful discussion. We always come up with these acronyms. It's called DREAM. And it's really another project they're working on to support as it says here, the design, content, and delivery of physical activity, healthy eating, and other wellness programs to meet the needs and preferences of people living with dementia and their families. And that's a Canada-wide project, but we've done a fair bit of contributing up here, including they've developed some videos. You may want to go on the CTAN website and you can link to that project. They've developed some videos that were done as part of the project, where seniors up here, older adults with dementia, without dementia, caregivers have talked about some of these questions around the physical activity, healthy eating, and the related questions, the kinds of things they see that are helpful and that will be something useful in terms of their own lives. So that's a really fast version of some of the projects. It's so exciting, the number of things that are going on. And I hope that you'll get a chance to maybe look at some of the things that we have, that I've listed there on the PowerPoint in terms of information about these projects. If you didn't get any of it and you've got my name, I'll connect you with the projects if you weren't able to get all the information. The main thing, I guess, that I really I just love the earlier presentations. The thing that I always underline and I feel like in my heart is that, well, I've said it here. We have such a role to play, whatever we're doing, whether we're in our communities as researchers, as families, as whatever our role is, to bring about these changes. And I really do firmly believe what I've written here. Everyone, by virtue of being human, has the right to live their life to the fullest. And the work that we collectively undertake and advocate for is an important contribution. It really is. And through it, I think you can feel the changes that are coming about. I'm very enthusiastic about the positive changes. And I think at the same time, I can start to feel, some of the negativity as well, that there's still, I go into this, this care facility and I think, oh my goodness, it doesn't feel person-centered. How do we do this? But you know what? If I think back to that day when those, it was two women that were tied to their wheelchairs and tied to that bar, and what a difference has happened since then. I always remind myself that advocacy, big and small, makes a difference. One carried there, whatever, we begin to really build that change that we all want to see. So thank you very much for giving me the opportunity to very quickly talk about some of the projects up here.